Okay. Welcome back. You know, I can't be too picky about my angle here because I just had back surgery and I can only do so much. So it's gonna be like this, and I'm so sorry. Hold on. Whatever, I'm done trying. This is it. So I'm gonna give a short run over because I've been going through this since like May of last year. So I'm gonna skip through most of that and mostly talk about what's been going on recently. So basically, in May of last year, I had a little pain, like a tiny just annoyance, but it was persistent, and then Peyton and I went to Nashville and it was very uncomfortable on the flight, and I was like, this is super weird, and it started to get hard to sit up and to stand up and sit down. So I went to the doctor, I got a prednisone pack, she told me to go to physical therapy, I went to physical therapy. They told me I had SI joint problems, and I was like, okay. So I did physical therapy for 6 or 7 months, and over that period of time it legitimately just got worse. It never got better for me. So we went back to the doctor. We basically got thrown around a ton. I gave up on physical therapy, I gave up on everything. I didn't really know what to do. Fast forward to Thanksgiving, it got so bad that we went to the ER that night. They did an MRI and discovered that I have a herniated disc in my back. So you're like, oh, that's probably what's been it the whole time. So I thought like going to my PT and telling them this would be like a big discovery, and they'd be like, oh my god, we can treat you now that we know. But I told them and they were like, oh, well, the treatment for SI joint and disc is the same, so since you didn't respond to the treatment, we don't really know. So I was like, oh, okay. So I was just excited that I had an actual diagnosis and it wasn't just like, we don't know what's wrong with you, but like try these exercises. So I thought that that meant that they would like be able to fix it. I ended up waiting for an appointment with a spine doctor because every ER doctor and PA that I could get in to see just suggested pain meds and physical therapy and stuff that I had already tried. I didn't do pain meds because I'm really weird about that. But so where was I? We ended up getting an appointment with an actual spine doctor. We had to wait a little while for it, and he recommended a injection, which I forgot to mention I had already had one in December. So by the time we're seeing this spine doctor, I think it's January or February, I had already gotten an injection. He recommended another one. He said that it's possible that they put it in the wrong spot. So I said, okay, I'll try one more. I really didn't think anything would be of it. I just knew that I had to try it before we could move on. And it hurt way worse than the first one. It was so painful. Didn't help me at all. So I went back to him, was like, it didn't help. And he was like, okay, well, we can do another one in this spot and another one in this spot, and then we'll move on. And I was like, I'm just not doing that. Like, they don't help me. They're $400 every single time. Like, no, I'm just not doing that. So we kind of waited it out for just a little while. We had, I'm all over the place. I skipped, so I think in February, my grandma was in the hospital. She lives in British Columbia, and our family up there basically told us that there's like a chance she's not gonna make it, and we were just like, okay, well, we'll be on our way. And my back was really bad at this point, but I was like, I don't care, like, I'm gonna see my grandma before that happens. And we all, in a fluster, like, booked plane tickets for the next day, which is very expensive to do last minute. And so the next day we all flew to Denver together because that's where we were connecting, and the flight was actual hell. I got there and I was like doubled over in pain, like wanted to throw up, couldn't walk, crying, couldn't carry my bag, like worst pain in my life. Like, I wanted to just sleep on the airport floor and not even care that I was in Denver. Like, I couldn't even fathom getting on another plane. I just wanted to like lay there and like not be in the situation I was in. Like, it was it was like a nightmare. So I ended up flying back to Billings like 2 hours after I'd been there, because to fly to Vancouver would have been another 3 hours, and I needed to just be at home because I could barely walk. So I flew back home, and I was like bedridden for a couple days. This was before the spine appointment. So from that point on was kind of like, obviously I've been dealing with this for a long time and working through it and everything, but from that point on it was like really bad, really painful, like so hard to go to work. So that was like mid-February, end of February. We decide that we need to see a surgeon. We tried everything, so we know of this really good surgeon. His name is Dr. Marone. I try and get an appointment with him. We have to wait 1 month. Our appointment was March 28th. So during that whole time, from like mid-end of February till this appointment, I literally slowly like died. Like near, I would say beginning mid-March, I stopped being able to work at Jake's, which is where I was serving, making the majority of my money. I also worked at a coffee shop, but it was a lot less strenuous on my body and paid a lot less. Jake's was really the job that paid my bills, so I couldn't work there anymore. I tried to work at the coffee shop for like about a week or two after that, and I ended up having to go home early like a couple times in a row, so we just kind of realized that it just like wasn't possible. So at that point I was legitimately in bed all day. Like getting up was 8 to 10 out of 10 pain, and oh my god, like it was insane. Like especially now that I've had the surgery, the post-op pain, like incisional pain, is like literally nothing. It's crazy. So anyways, we had an appointment March 28th, and he's like, yeah, come in on Monday, which was April 1st, which was like a little over a week ago. So I went in and I had a L5-S1 discectomy, and now I'm here. So I don't know, it's really, 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 really insane, like having your life taken away. I don't want to cry. The whole time that I was like going through this, I kept texting my mom and being like, Mom, what if I can't go to work? Like, we don't have like money. So I'm just saying, like, Mom, like, what if I can't go to work? Like, are you prepared to help me? I have no backup plan. I don't know. You know, I live by myself. I don't have any roommates. I haven't lived at home for a couple years, so I have all my own bills. Like, I'm a completely singular person, so that's a lot for my parent to take over. And it was like my worst nightmare, my biggest fear, that I wouldn't be able to go to work anymore, and it happened. And it's been so hard. Like, oh my god, it's a terrible feeling having to sit here and be taken care of and just like hope that people give me money so I can pay my bills. It's terrible. But I guess if you're not struggling with back issues, a message that I would want to send in this video is today I got to drive my car for the first time. It has been, I think it's April 10th, and it's been 10 days since the surgery. And I got to go hang out with my sister and get a coffee, and it was like the most fun I've had in like at least like 3 months. And you would never know how much you would enjoy doing these things that we get to do all the time, and just like living our lives until you can't do it anymore. I would literally do anything to be able to go to work tomorrow. This is not supposed to be a pity party. I know when we see other people in these circumstances and people get cancer all the time, and you're just like, oh my god, that's terrible, I feel so grateful for my life. But when you actually, I don't have cancer, but when you actually go through something that strips you of your life, I will never be the same. I will never be the same, and like I just want to walk my dog and drive my car to work and pay my own bills and not have to rely on anybody. And I don't know, I just wanted to get that message across because I'm a completely different person because this happened to me. I never thought anything like this would happen to me, but yeah. If you're watching this video because you're wondering about the surgery, because maybe you're going through the same thing, because I've watched a lot of videos about people with the surgery so that I would know what to expect. Right after I woke up, I could completely tell that what had been bothering me was gone. I was in no pain for, I would say, about 2 days. I was on narcotics, but I stayed the night in the hospital. I was up and walking almost 6 hours after the surgery. I came home the next day. I stayed on, it was hydromorphone for only like 2 or 3 days after the surgery, and I hated it, and I stopped taking it and said only Tylenol if I need it, but I really honestly have only taken it like a couple times. I think my pain tolerance is just so high because what I'm going through now is just absolutely nothing compared to what it was before. I can do just about anything except for bend, lift, and twist, which is what any back surgery patient is not allowed to do for a long time. So I can't really put on pants or shoes or socks or like bend over for the fridge or pick stuff up, which is why I need a lot of help. But like, I can walk around my house. I'm fine. I get tired really easily. Like if I'm up and about, I kind of have to lay down after a while. But yeah, I'm doing like really good. It's just the hardest thing at this point is feeling fine, like compared to where I was before, and not being able to work. But at least I'm on the road to back to normal. Just wanted to make this just to, a lot of people have back problems. Like a herniated disc is a very common problem, and I want to make it really clear because someone messaged me on Instagram and asked me if I tried like spinal decompression. I tried everything. Everything. I literally have done anything that you could think of. So before you tell me that I shouldn't have had surgery, just don't, because trust me, I didn't want surgery until I couldn't walk. Okay. But if you are having back problems, because it is so common, I'm very knowledgeable on the topic now, and I'd love to talk to you about it. And I have a lot of coping mechanisms and a lot of ways to get by because I did for so long. And please keep good form when you're doing squats and deadlifts, and don't curve your back when you're bending over, please. Every time I see someone doing something wrong, I'm like, please don't, you're gonna get surgery, please. Because people just have terrible posture and like, they just get away with it. There's a lot of people in the world who have herniated discs and have no symptoms, but there is a few % who it completely debilitates them. So that's all. Feel free to reach out to me if you do have problems like that. Okay? Thanks for watching.